For decades, vitamin supplements have been sold as insurance against disease and aging, tiny capsules of preventive medicine promising better energy, longer life, and healthier hearts. But as supplement use has skyrocketed, especially among health-conscious adults and older populations, a different story has emerged, not from flashy marketing campaigns or small lab studies, but from large-scale epidemiological research tracking real people over years. And what these long-term studies show is far less reassuring. In certain groups, especially those without clear deficiencies, high-dose B vitamin supplementation has been linked with increased risk of cardiovascular events and even all-cause mortality. One of the most cited studies in this arena is the Iowa Women's Health Study, which tracked over 38,000 older women for nearly 2 decades. Researchers found that women who regularly used multivitamins, B6, folic acid, and other supplements actually had a higher risk of death, even after adjusting for lifestyle and dietary variables. Specifically, folic acid and B6 stood out for their unexpected association with increased all-cause mortality. This was a sobering contradiction to the popular belief that more nutrients equals more life. Then there's the Norvit trial, a randomized controlled study involving over 3,700 patients who had recently suffered a heart attack. Participants were given high doses of folic acid, 0.8 milligrams, vitamin B12, 0.4 milligrams, and vitamin B6, 40 milligrams, a cocktail intended to lower homocysteine levels, a known cardiovascular risk marker. The results? Homocysteine levels dropped, but the rate of new heart attacks and strokes actually went up in the group receiving the B vitamin therapy. It was a stark example of a biochemical improvement that didn't translate to clinical benefit and may have caused harm. This pattern was echoed in the SU-FWELD OM3 study, a French trial that followed over 2,500 cardiovascular patients for 5 years. Despite achieving reductions in homocysteine with high-dose folic acid and B vitamins, the researchers saw no significant improvement in cardiovascular outcomes. More worryingly, other observational data has suggested that high folate intake in the context of low B12 status may increase the risk of cognitive decline and anemia, especially in the elderly. Another high-profile study is the SELECT trial, which looked at over 35,000 men and examined the effects of vitamin E and selenium on prostate cancer risk. Although not B vitamins, the broader takeaway remains relevant. Even nutrients with plausible biological benefits can, at high doses, increase disease risk when used preventively in otherwise healthy populations. Of course, not all studies paint such a bleak picture. In individuals with diagnosed deficiencies, or in very specific clinical contexts, like using B12 to treat pernicious anemia, supplementation is unquestionably life-saving. But the problem lies in the general, non-targeted use of high-dose B vitamins, particularly B6, folic acid, and niacin, B3, among populations already meeting their needs through fortified foods and a balanced diet. It's not just about excess, but also about bioavailability and metabolism. Synthetic folic acid, for instance, must be converted by the liver before it becomes biologically active. When consumed in excess, especially by those with MTHFR polymorphisms or sluggish detox pathways, it can accumulate in its unmetabolized form, which has been linked to immune dysfunction, vascular stress, and tumor growth in some contexts. Similarly, high-dose niacin has shown benefit in lipid modification but failed to improve cardiovascular outcomes in large trials like HM-HI and HBS2 Thrive, while increasing the risk of stroke, gastrointestinal events, and liver dysfunction. In summary, these large cohort and randomized studies reveal a clear message: more is not always better, especially when it comes to B vitamins. The benefits of supplementation appear highly context-dependent, with potential harms emerging when nutrients are used in pharmacological doses without medical necessity. While public health policies still promote fortification to prevent deficiency in vulnerable populations, the indiscriminate layering of high-dose B vitamins, through enriched foods, multivitamins, and targeted longevity supplements, may be quietly contributing to long-term health risks in well-nourished individuals. So, if you're taking B vitamins every day without a deficiency, the question isn't just, am I covered? But at what cost?